Have any of you ever interacted with a child who has a stuttering problem? Or maybe they can't pronounce their R or S? Or maybe you have an elderly neighbor and they can't quite seem to remember the last word they need in a sentence. Is there a way to help these people, or is there anyone who can help these people? That's where a speech language pathologist comes into play. A speech language pathologist, or SLP for short, is a professional that diagnoses and treats people with either a speech or language disability. But what is a speech and a language disability? A speech disability is an impairment in speech sounds, fluencies, and voice. Common examples of this would be an articulation disorder, stuttering, or impairment within muscle movement of the mouth that prohibits the formation of certain sounds. A language disability is a communicative disorder that makes it hard to understand or use a language. This usually is due to an impairment within the brain or nervous system. A common example of this would be a stroke that prohibits the recollection of certain words. Speech language pathologists deal with a variety of patients, but the most common age range is young children from the ages 1 to 12 or older patients from the ages 60 and older. A speech language pathologist's first objective when dealing with a client is to observe the client and figure out if they have a speech or language disability. In order to do this, the speech language pathologist will have the client perform simple tasks such as reading a book, naming objects in a room, or even just recounting their day's events. Once the speech language pathologist has acquired all the necessary information, they will then have the client come to daily sessions. These daily sessions will have specific objectives that will need to be performed by the client. For example, a speech language pathologist will have a client come in and color a page, but while they're coloring the page, they must list the objects on the page that have a sh sound. This in turn helps the client learn the sh sound and become more comfortable with it. Speech language pathologists are growing in number and demand. According to the University of Northern Iowa, the need for speech language pathologists is estimated to grow by 18% from the years 2023 to 2033. But why is there such a large growth? Well, according to the Bureau of Labor Statistics, speech language pathologists are growing in demand due to the baby boomer generation getting older, thus resulting in an increase in hearing loss and strokes. The second reason is due to medical advances. Medical advances are increasing the likelihood of survival for premature babies. Due to this, premature babies need speech and language intervention. Speech language pathologists, as I've already stated, are becoming increasing in number and demand, but their importance is also increasing within the health and science field. Speech language pathologists are necessary in order to help reform and treat patients with a speech and language disability. And because of this, speech language pathologists are helping recover one of God's greatest gifts in people, the art of communication, and will continue to do so as they continue to grow.